Hello, today we're here with Patsy Cannon, a physical therapist at Patricia Neal Rehab Center, and she is going to help us with our presentation on conversion disorder. And she's going to tell us what conversion disorder is.
In my experience, when I work with a patient who has conversion disorder, they present with physical problems that cannot be contributed to an organic problem. Thus, it's probably due to a psychological experience in their life or a problem causing those physical problems to manifest.
Okay, how can you tell the difference between making up their symptoms or malingering and conversion disorder?
I'm a neurological physical therapist, so I work with patients who present with neurological symptoms, signs and symptoms. Those people who are malingering, most of their symptoms are they're trying to present themselves in a way that will mimic a disorder, usually a stroke or a traumatic brain injury. However, since they have not experienced one, then the signs and symptoms are not always consistent in my experience of what I am normally working with. They're also kind of inconsistent. One day they may present a certain way, and then the next day they'll forget something that they did, so they'll present a little different. Someone who has a conversion disorder, they usually present consistently the same way. They have no idea that it's not an organic problem, because they truly believe it's an organic problem, such as a stroke, that's causing these symptoms. However, in a malingering, they are usually intentionally or purposefully trying to present this way. So you can tell sometimes with the intent and the attitude of the person which one is malingering and which one is conversion disorder.
So do you treat a conversion patient the same as any other patient?
I treat what I see, the symptoms of a patient, no matter what causes the symptoms. So yes, I treat a patient with a conversion disorder exactly the same as I treat someone who's had a stroke or traumatic brain injury or some other neurological event. However, if I suspect or know that it's a conversion disorder, I do try to work on giving them extra encouragement and coaxing and praising them, because their problems are stemming from a psychological reason. They usually had a traumatic event in their early years or recently had a traumatic event that will trigger these symptoms. So they have not had affirmation and validation and praise and all those things that cause them to have good self-esteem and to grow psychologically when they're younger. So I try to encourage them so that they will make good recovery.
So with that being said, do you have to treat the patient's psychological feelings before their physical symptoms improve?
Not always. I'm a physical therapist, so I will treat them physically. But with that being said, I will always treat the patient holistically. So as I'm treating them physically, I'm always addressing their psychological needs. However, sometimes when you initially see someone, and if it's a recent conversion, and they can make quick progress, so they may progress with just physical therapy intervention without having to see a clinical psychologist or behavioral medicine. If I work with someone and I suspect or know that they have a conversion disorder, I will always make a referral for them to be seen by a psychologist so that they can have a more comprehensive approach to their problem. And if their progress is slowing down, then I will most definitely make a referral so that their psychological needs can be met.
Do these patients progress faster in PT?
Actually, most of the people with conversion disorders make miraculous recoveries. They have the abilities, they just don't realize they have it. So if you work with them and they start seeing that, oh, my arm is moving now, I was once paralyzed but now I'm moving, they can make extremely fast progress. Occasionally I'll have a client who has psychological problems due to traumatic events in their early years. These are deep-rooted problems, and sometimes they have hidden these problems so that they can deal with them, and something has triggered them and they manifest themselves, and simple physical therapy is not having that amazing recovery, so they take a lot longer. But in general, most make tremendous progress faster than your average person who is exhibiting physical problems due to an organic event.
So do you correct the patient or go along with their thought of having paralysis from a stroke when they did not?
I always go along with what the patient thinks. If he thinks that he's had a stroke, then I allow him to think that. I am a physical therapist and I work primarily on their physical problems. The rapport that I establish with them, it can be very fragile, and I do not want to put that rapport in jeopardy. If I tell them that their problems are not due to an organic problem and that it's psychological, a lot of them will become very defensive. They'll think that I think they're crazy, or that I'm saying they're crazy, and usually there have been people in their family or friends or social circle that's telling them that they're crazy, and that just pushes them farther away from you, and they won't have the trust to work with you. And so I go along with them. Usually a psychologist is working with them, and they will work with them on the psychological reasons why these physical problems are manifesting, and that's more their area of expertise. And I work according to the guidance of my psychologist.
Why would treating a patient with conversion be hard when their symptoms are not real?
It's really hard because their symptoms are real to them. It doesn't matter what I think or anyone else thinks. What matters is what they think, and what they think is the reason why they are having these problems. Their physical problems is due to psychological problems. In my limited association with them, I have no way of knowing what traumatic events they've had and how many years they've been hiding them or trying to deal with this certain situation. So it's just really hard. I have to concentrate really hard to work with their physical problems, and then also be sure I maintain this rapport and address their their psychological needs, and not push them too hard. So it's a very stressful working with them.
Okay, and that'll be it. Thank you for helping us out with our project.